Hi, everyone. Today, we're talking about medical volunteering, a critical component of your med or dental school application. Many students treat volunteering as a numbers game, just trying to fill up hours. But admissions officers aren't looking for a calculator. They are looking for a human being. While the average applicant has over 300 hours, what truly matters isn't hopping between 5 different places. It's about how long and how sincerely you committed to 1 or 2 roles. A one-day event at a famous organization means little. They want to see your empathy, altruism, and attitude. So, don't just ask, what did I do? Ask yourself, how did this change me? Let's start with the most common option, hospital volunteering. Most large US hospitals have structured programs. To be clear, you won't be performing medical procedures. Your role is to support the environment so the medical team can function. This includes guiding patients at the front desk, transporting patients in wheelchairs, or stocking supplies. In the ER, you might comfort families, and in pediatrics, you might play with children. The common thread here is that you are a field supporter working closely with patients and staff to keep the hospital running smoothly. Getting into a hospital program takes time and patience. Usually you apply online, often submitting essays or references. If you pass the initial screen, you'll interview with the coordinator to be placed in a department. Then comes the heavy lifting, background checks, drug screens, and immunization records, including TB tests. Some hospitals even require an SSN for identity verification. After orientation and HIPAA training, the whole process can take 4 to 8 weeks. Most programs require a commitment of at least 6 months, usually once a week. Why go through all this trouble? Because the benefits are clear. First, exposure. You see the entire system, admission, surgery, recovery, and understand how healthcare operates. Second, teamwork. You witness how doctors, nurses, and pharmacists collaborate. Third, empathy. Comforting an anxious patient teaches you communication skills no textbook can offer. Finally, reliability. Hundreds of hours of consistent attendance send a powerful signal to admissions officers that you are responsible and dedicated. However, hospital volunteering isn't a magic bullet. Your scope is limited. You might spend hours just cleaning wheelchairs or moving boxes. It rarely offers hands-on clinical skills. Plus, the administrative burden is high, and balancing shifts with schoolwork can be tough. Patient contact is often brief, so you might not fully grasp the doctor's role. But even realizing that this environment is tough is a valuable lesson. It helps you verify if you can handle the reality of a hospital setting. Now, let's look outside the hospital. Nursing homes and long-term care facilities focus on relationships rather than procedures. You help with daily life, reading, chatting, walking, or assisting with meals. The core value here is emotional connection. You build long-term bonds with residents and learn patience and listening skills. Witnessing chronic conditions like dementia up close teaches you what care really means in old age. While you won't learn technical skills, you will learn the essence of patient-centered care. Hospice volunteering is special. It involves supporting terminally ill patients and their families during their final moments. You might simply hold a hand, play music, or give family members a brief break. This role requires rigorous training, often 10 to 30 hours, and a long-term commitment. Emotionally, it is incredibly challenging. But facing life and death so closely forces you to reflect deeply on medical ethics and empathy. Many students say this experience helped them grow the most as human beings. Free clinics serve the underserved and offer a raw look at healthcare inequality. Here, you might help with intake, taking vitals, or translation. You'll meet patients with no insurance, language barriers, or financial struggles. You realize that medical inequality isn't just a concept, it's reality. Solving problems in a resource-limited environment builds both clinical sense and social responsibility. However, schedules can be irregular, and getting these positions can be quite competitive. Can F-1 students volunteer? Yes, but you must follow the rules. It must be pure volunteering at a nonprofit organization with absolutely no pay. You cannot replace a paid employee, and you cannot do unpaid work in a position that usually pays. Your priority is your full-time student status, so volunteering must not interfere with your studies. For safety, always consult your International Student Office, ISS, and keep a detailed log of your hours. Securing these opportunities alone is not easy. At PharmMedi-Lab, we use our network to connect you with reliable clinical experiences and help manage your strategy. We turn simple observation into a learning journey through mentoring. Most importantly, we guide you on how to weave these stories into your essays, interviews, and recommendation letters. Remember, volunteering isn't an option. It's a window into your values. It's not about where, but about how deep and how sincere. Visit PharmMedi-Lab today to start your journey. Thank you.